Hey guys, this is Dr. Herb. Today we'll look at the transition of the layers from the abdominal wall to the scrotum. So to get started, first is the layers of the abdominal wall. So the layers of the abdominal wall, it includes the skin. So this skin of the abdominal wall, it corresponds to that of the skin of the scrotum. So skin is nothing but the skin. Then what about the superficial fascia? The superficial fascia is nothing but the campers and the scarpa. So it includes the camper as well as the scarpa. So the campers and the scarpa, what does it correlate to? Corresponding layers of the scrotum, it is nothing but the colles. It corresponds to the colles fascia and also the presence of the dartos. So colles fascia as well as the dartos muscle. Then there is the external oblique muscle. So external oblique muscle, we are writing it as EOM. So this corresponds to the external spermatic fascia. So external spermatic fascia. Next is the internal oblique muscle. So this internal oblique muscle, it corresponds to the cremastic fascia and the muscle. So the external oblique muscle is the external spermatic fascia and the internal oblique muscle is the cremastic fascia and the muscles. Then we look at the transverse abdominis muscle. The transverse abdominis muscle is nothing but, we are writing it as TAM. So the TA muscle, transverse abdominis muscle. So this, what happens is in the scrotum, it does not continue. So we write a X. Next is, we look at the transversalis fascia. So the transversalis fascia, we'll write it as TF. So T fascia, that is a transversalis fascia. So transversalis fascia, it continues as a internal spermatic fascia. So it continues as a internal spermatic fascia. Next comes the extra peritoneal, E-peritoneal, that is the extra peritoneal fat. So this extra peritoneal fat, it is same as, it continues as the extra peritoneal fat. Next is the parietal peritoneum. So parietal peritoneum. So we are writing it as PP. So the parietal peritoneum, it continues as a TV, there is a tunica vaginalis.